So welcome everyone to the Healthwatch Enfield public meeting for children and young people's social and emotional well-being and mental health. I will go through some housekeeping issues and then go through the introductions, but I'm the Acting Chief Executive, Fazila Ahmed. So welcome everyone for this call. Hopefully it'll be a really interesting session. Just before we start, say a little bit of housekeeping in terms of the ground rules. So because there'll be so many people on the call, we do unfortunately have to keep you all on mute and off camera to help with the connection issues. We will have hopefully received your questions in advance, so we will be going through those. But if you look at the bottom of your screen, you should see a chat, like a speech bubble. And if you click on that, actually one of our team, Sue Jane's already said welcome. At the bottom, you can see to everyone, there's a little arrow and it says type message here. So you can type a message and ask a question, either send that to everyone, or you could just send it to the presenters if you don't want everyone to see your comments. So if you're doing it to everyone, literally everyone will see what you're writing. And what we'll try and do is invite some of those comments and questions as we go along if we have time. So I can't guarantee that, I'm afraid, because we do prioritise the questions that came in advance. The other thing is, if you look to your right hand top screen, you'll see what it calls speaker view with some icons again, and if you press on that, you can either see one individual, whoever's particular of interest to you, and the BSL interpreter. If you click on their picture, on Simone's picture, you'll see there are 3 dots. And if you click on that, it gives you some options, and it gives you the option to pin the video. So if you press pin the video, then regardless of who's speaking, you will be able to actually see Simone signing. So if you need that opportunity, that's the best one. Otherwise, I suggest either gallery view or I think speaker view is the best one, because it just shows the people who are on camera. So I think we've gone through everything. If there are any technical issues, I'm afraid it's really difficult to resolve those on an individual basis. The only thing I can suggest is if you can't hear or you can't see, using the chat, and we can try and do something about it, or otherwise just log off and go out of the call completely and then go back in again. That might be something that helps fix it. And the other thing, just to remind you that within your invites you should have got a link to a survey that we send out, so we'd really appreciate before you leave if you can complete that survey, because we do use feedback and we do use that information to improve. So for example, people were saying an hour isn't quite long enough. We've tried an hour and a half, which maybe might be too long for some, so we're now trying an hour and a quarter. So without further ado, I'm going to kick off formally and say welcome to our panel guests. I will ask them to introduce themselves shortly, but if I just say from my pictures, we've got Dr. Emma Gore-Langton, who's the Senior Educational Psychologist and Lead for Social, Emotional, Mental Health and Wellbeing. We've got Peter Nathan, who's the Director of Education from the local authority, so both Emma and Peter are from the local authority. And then from Barnet, Enfield, Haringey Mental Health Trust, we have Nicholas Clark, who's the Consultant Clinical Psychologist and Enfield Child and Adolescent Mental Health Services Clinical Lead, and Clive Blackwood, who's the Senior Service Lead for Enfield CAMS team, which is your Child Adolescent Mental Health Service and Children's Services. So a bit of a long one there, but if we can kick off, I shall kick off initially with a quick update from Healthwatch Enfield, and then I will pass on to each of the presenters to introduce themselves. So from a Healthwatch perspective, again, you always know, we keep busy. That's relevant to particularly young people and children's mental health. We recently produced a report that was on our website now, has been recently published, around children's and young people's mental health under lockdown and COVID. So that would be quite interesting. What we have done is already forwarded that on to commissioners, people who make decisions around mental health provision, to the local authority, to really try and say, you know, give the views of young people and what they are saying. And a lot of young people are telling us that they are very concerned about mental health and well-being, whether it's about school exams. We know the issues they've had with A-level results. We've got GCSE results coming out shortly. Obviously lockdown and how that's impacting on their health and access to services. So an important report, if you want to access that, that's on our website. Sorry, that's on our website. And we've also recently produced a report around befriending services and how we were talking to individuals again during lockdown, vulnerable people, and some of the issues that they were challenged and faced. And we've also launched a GP video, just about lots of people have been asking us about access to GPs and what they should be expecting and how GP surgeries are going to operate going forward. So again, that's on our website. It's a short 2-minute video, so do watch. So without further ado, I'm going to pass you on to first, I think, to the local authority, to Peter and then Nathan to introduce themselves, and then I'm just going to do a quick presentation. So Peter, if you want to unmute yourself, and yeah.
Sure. Hi everybody, my name is Peter Nathan, Director of Education. I've been in Enfield for about a year now and held a similar role in another local authority.
Please, just a little bit slower so I can keep up with you, thank you. Sorry, just a little bit slower.
Okay, good afternoon everybody. I won't do play school language, but anyway. So my name is Peter Nathan. I am Director of Education. I've been in post for about a year now here, held a similar role in another local authority for about 4.5 years, 5 years. I'm not going to say too much now. I don't want to take up the time for this presentation, but I'm going to hand over to Emma, who's going to just talk you through a few slides, which will explain some of the things that have been going on in our approach, which I hope will be very helpful. So thank you, and over to Emma.
Emma, I will start to share the slides if you want to introduce yourself as I do that.
Thanks, Fazila. Hi everyone, I'm Emma Gore-Langton. I'm the Senior Specialist Educational Psychologist for Social, Emotional and Mental Health. And I just wanted to share with you kind of the background to the approach which has shaped all of the work that we've done as a local authority and as a partnership during the pandemic. Thanks, Fazila. Next slide, please.
Okay, yep.
Lovely, thank you. So at a very early stage in the pandemic, we were lucky to have educational psychologists in our service who had been working for Kensington and Chelsea at the time of the Grenfell tragedy. And they shared with us this framework, which comes from the psychological literature, everything that we've learned about how to support people who are experiencing traumatic events, which gives us 5 very simple principles. And we have been able to hang our thinking and our offer to schools and families and young people on these 5 principles. So this is the idea that our children, our parents, our school staff, and we ourselves as kind of professionals behind the scenes, all the way through have needed a sense of safety. So a sense that we're physically safe, but also that psychological safety, which is so important. We've needed a sense of calm, so for our children to be able to settle, to be able to learn, to be able to enjoy themselves, first they need to feel calm. A sense of connectedness and how to create that at a time when we're all being forced to keep our distance in so many ways. How to help our children to feel a sense of control at a time when everything, almost everything, feels really outside our control as adults, let alone outside the control of our children. And how, despite everything at the moment, to help our children and our families hold on to a sense of hope that things will get better and this won't last forever. Thank you, Fazila. Next slide, please. Thank you. Lovely. And I guess through it all, we know that this is difficult. We know that lots of people are in really tricky situations, but we've tried hard to meet people where they are. So at an early stage in the pandemic, there was this quite unhelpful message, I think, that we were all in the same storm, that we were all in this together. We were all in the same situation. And we've heard from lots of our families that really actually know. Lots of our families are under all sorts of additional pressures that aren't universal. So the pressures of having one or more children with special educational needs, financial pressures, being in unsuitable housing, things that really make this even more challenging. So what we've held on to is the idea that we may all be in the same storm, but we're all in different boats. And we know that some of our families, Fazila was saying earlier, perhaps feel that they don't have a boat at all, that they're in the water and finding things really difficult. So we've tried to listen to local needs and adapt things. Thank you. Next slide. Thank you. And the way that we did this at a very early stage was to pull together. So we know that we are stronger when we know what our partner services are offering, when we're thinking together about how to adapt to this unique situation. So Enfield Thrives Together is a network which was developed alongside Enfield Stands Together and Enfield Learns Together. We started off with 4 partner services at the beginning of the pandemic, a partnership between the council and checking in with our network every 2 weeks to keep each other up to date on what we're offering, how we've adapted our offer during COVID. And it's a unique chance for us every 2 weeks to hear directly from families and from schools. So we have school representatives from primary, secondary and specialist provisions, and we have our parent representatives who tell us what's going on for them and for other parents so that we can adapt accordingly. So I hope that that's a helpful overview of how we've thought about and planned our support for you at this time, and we'll refer back to this as we're chatting through your questions. Thanks so much.
Hi, sorry, just trying to unmute myself at the same time. So thanks, that was really helpful. And I think it's really important to stress that whole picture that, you know, people just say we're all in the same boat and we're not. And I think it's just understanding individuals' needs. And I think particularly for young people, I was listening to a radio program last week, and there were a number of young people on saying that they don't feel that they have a platform or able to voice their opinions, that people are really listening to them. So I think it's really important that within Enfield, at least if we can offer that's key. I'd like to pass us on to Barnet and Enfield Haringey Mental Health Trust and the Children and Adolescent Mental Health Team. So Clive and Nicholas, can you introduce yourselves and then just give us a bit of an overview of the service? Thanks.
So my name is Nick Clark. I'm a consultant clinical psychologist. So I work as a clinician in a team called SAFE, which is the Service for Adolescents and Families in Enfield, which is one of our specialist teams in CAMS, which is a crisis support team for teenagers. And the other part of my role is it's a leadership role as the clinical lead for Enfield CAMS, covering all our different teams.
Shall I try again? Okay, so my name is Clive Blackwood. I'm the Senior Service Lead for Child and Adolescent Mental Health Services and for Community Children's Services in Enfield.
That's great, thank you. Yeah, if you want to give us a bit of an update, that would be great because we can hear you clearly now.
Okay, excellent. So Nick's just going to give a bit of an overview as to what we've been doing during the pandemic, and I'll obviously add a bit in relation to the context of where things are at now for us as a service and the trust overall.
Okay, so just to start with, I just wanted to give just a brief overview of the CAMS service in Enfield. So the service is made up of a number of teams which cater to different types and different levels of need. So the biggest team is a generic team which really covers the range of common mental health problems in children and young people. We also have the team which I mentioned that I work in, which is a team for crisis support in adolescents. We have a team which focuses on support for children and young people with learning disabilities and neurodevelopmental problems, and works very closely with special schools in the borough. And we also have a small team which works very closely in partnership with children's social care, supporting looked after children in the borough. And then we also have members of staff who kind of work in other services in the borough as a CAMS clinician, say seconded into other services. So for example, in youth offending services, in the child development team, so the children's health services. And then another kind of important part of the service is a new team which is in development, which is in the first year of a 2-year pilot, which is our mental health support team in schools, which is a partnership between CAMS and the educational psychology service, providing part of a national initiative to increase the level of support in the schools-based service. So that's just an overview of our teams and the areas that we cover. Just in terms of I just want to say a little bit about what we've been doing during the pandemic. So our service, our opening hours, our contact arrangements have all been operating as normal throughout the pandemic. We've had a reduced staff presence in our clinics to manage social distancing, but staff have continued to provide all routine services throughout. And we've also had kind of improved arrangements for kind of on-call cover out of hours during the pandemic as well. So overall, we're providing all our usual services, but in modified ways. We've been continued to provide face-to-face contact in the clinic where that was urgent and essential. But in most instances, speaking over the phone or over video link has been the first line offer in recent months. And now we've got a well-established video therapy platform, and the take-up has been quite high overall with that. I think the other sort of important area in terms of our response during the pandemic is there's been a lot of work across Barnet, Enfield and Haringey, but Camden and Islington as well, about strengthening the whole sort of system for crisis support across that large area. And really there's been 3 main components to that. So one has been having a duty line for professionals to call when there are concerns about children and young people who might be experiencing crisis and may need urgent support. The second component is about putting in place a crisis helpline for children, young people and families. And so this is a number that children, young people and families can call to get support or advice, again, when there are urgent crisis needs, 24/7. And then the third aspect is about continuing to provide urgent assessments in a hospital setting where they're needed, but also in the early stages of the pandemic, we were also trying to divert some of those urgent assessments to our community clinic in order to support the acute hospitals in terms of their response to the pandemic and to the needs of COVID patients.
Thanks, that's really helpful. And I guess because it's in development, I'm just wondering, I know the Barnet and Enfield Haringey website will have some of these links, but I guess if you can share them with us either after the call,
Yeah.
or if we've got access to it, maybe some of the guys can be Googling and putting that up on the chat. That would be helpful, just in case people need to know. And in terms of access, obviously, other than the school, which is an obvious one, I'm assuming it's by referral from professionals, or can parents or young people self-refer?
In terms of referrals to the services, yeah, so we take referrals, so from GPs, from schools, from social services, or kind of other agencies working with children, young people and families.
Okay. And I think when we go through some of the questions, we can explain how to access, but I think if children are still at school or college, that's a helpful way of asking for help in the first instance. Or if they're already left at that point, then the GP probably is that next port of call. So thank you for that. I think that was helpful. So what we'll do is we'll go to the questions that have already been asked by the public, and we'll take in turns. Education can respond, and then the CAMS team. And in the meantime, if people want to ask questions on the chat or make comments, to say, I can't guarantee that we can respond to everything, but if we can and we've got time, then I'll try and bring that into the conversation, so it's a little bit more interactive. So if we can kick off with the first question, it says here, what plans are being put in place if by September, we're almost there, children and young people are not able to return to school or college due to either a rise in coronavirus infections or a localised lockdown? So perhaps if education can respond to that one, Peter, first.
Yeah, sure. So basically, schools in the summer term got quite used to, or developed their processes for working with young people when they were at home, children and young people. So the expectation is, not actually from the start of term, because many schools are going to have staggered starts, because you have to remember that some children haven't been in school since March. So that's quite a long time to be out of school. So the first week or two, and actually more than that, but certainly the first week or two will be about reintegrating children back into school, understanding new procedures, particularly in terms of cleanliness and stuff like that, which we're all aware of. But children got to get used to that. We found actually that children were quite resilient coming back to school in the summer term. So we're hoping that will be the case. Obviously not for all children, but in terms of the children who aren't in school, and that could possibly happen for a variety of reasons. One is a local lockdown in a school. We had a couple of instances where not a school lockdown happened in the summer, but actually there was a bubble was sent home. Then the expectation is that schools will use their online learning processes that they have in place, so children won't miss out. Obviously, online learning is not the same. The schools were developing and improving their practice. It's a big focus for us in education. We've developed a course for schools on digital technologies, which we're working with, actually one of the few local authorities working with the DFE on this, to improve the online experience of young people. Because what we found was that we had a public meeting in the summer, organised through HERD. Some schools, brilliant, no issues at all. Other schools, not as good. So we produced a document which was a levelling up of what the expectations should be. That's been sent to all school in agreement with head teachers. So what we are looking to work with schools that need it, to look at good practice, because there's a lot of great practice around, to ensure that if young people aren't in school or children aren't in school, they will get good quality learning. Recognising, of course, it's not the same as being in school. So it'll vary we have 96 schools in Enfield. It's going to vary quite considerably from school to school. But we know that we actually had a lot of good feedback, certainly in terms of contact anyway, particularly from parents of children who've got special needs. Although again, I have to say it is variable.
And I'm guessing there again, if they're not in school and parents or young people themselves are concerned about their own mental health, they should be flagging that directly to the school.
If children are, if children aren't coming into school, well, one, the government made it clear children should be coming into school. However, we, as a local authority, we realise that, particularly with the messaging from the government about, stay at home, and how to change that, that's a problem. And some people will have genuine concerns. So our education and welfare service, variety of other staff, educational psychologists, but also the schools themselves won't be taking a hard line on this, but we're working with people to basically say, look, the data says young people are in no real danger. I mean, admittedly, there's going to be occasions, but actually the data on young people and the advice I had from our public health is actually children are very bad at getting it and very bad at spreading it. And I'm directly quoting our public health people. The issue is more for teachers, actually. But even then, the younger you are, fortunately I'm old, but anyway, the younger you are, the less chance you have. And if you're healthy, so it's about reassurance, talking through the measures that schools have put in place. I've just had an email from a head talking about the staggered start times, for example, to avoid crowding at the start of the school day and at the end of the school day, and about the processes that schools will be using. Easier in primary than in secondary, of course. But secondary schools are, put together quite comprehensive risk assessments. One of the things we've asked schools to do is to send us their risk assessments so we can look through them. One of the reasons for this is that sometimes when you're heavily involved in something, you can't see the wood for the trees. And a couple of examples of that, we just say to schools, yeah, you may want to do that, but we wouldn't advise this, do it in a slightly different way. So we're all trying to work together to come to the best possible solutions. But that includes, go on, sorry.
Sorry, interrupting. I'm just thinking again, because this question was about not being in school. So will you have a register? Will there be oversight for those who are not attending for whatever reason?
So that is the responsibility of schools. We would have, in the old days, we would have been able to do it, but schools are using a wide variety of platforms. Whoever would have heard of Purple Mash before, for example, but that's one of the platforms I know a number of schools are using. Some are using Google Classrooms. So to get an overall coordination, we can't possibly do it, but it will be in the risk assessments, and our school improvement advisors will be following this up in their visits with schools to make sure that the right things are in place.
Okay, thank you, Peter. So Emma, any other thoughts? Otherwise I'll pass over to the CAMS team.
No, just the general reinforcement that heads have been meeting weekly, and they've been talking about how to do better in the next lockdown since before the first lockdown ended. And I think, as Peter said, two big focuses for that have been how to improve the online learning offering, but also learning from what we've heard from children and parents, which is that the communication, the type of communication, the volume of communication has made a big difference to families. So that heads have been meeting together to share the good stuff they've been doing and how to do better next time communication wise.
Thanks. I'm going to pass it on to CAMS and let them respond to a degree if they've got any tips or if they've been working with schools, and then we'll take it from there. There's a question there about bubbles, but we can go back to that, but I can imagine it being quite technical. So whether you can have a 1 minute response on bubbles in a minute, Peter, but I'm just going to pass it on to the CAMS team.
So I think briefly from our point of view, because I guess if children, young people weren't able to return to school or college due to a second wave or a localised lockdown, from our point of view, we'd be continuing to provide services in the way that we have done in recent months, really. So we've continued providing a service through the lockdown and through school closures. We continue to do that. We'd still be very much wanting to link with schools and other schools facing services, and as best we can, we're continuing with the rollout of the mental health support teams in schools as well. And I guess their plans have been disrupted by the pandemic and by school closures, but they have continued to work closely with the early implementer schools to try and support those schools in their pandemic response, help them develop resources for teachers, for parents and young people, and so on.
And there is just one other point. There is an element around how we continue to reach out. So in effect, if schools are closed, because clearly the schools is a very key element to supporting children and young people, and that network isn't there at the moment. So how do families and carers access support through CAMS? Well, there's still the element by which we can offer consultation to some of those schools that are identified where they may be locked down, but also in terms of how we are ensuring that we're publicising information on our websites, and how we're enabling families to be mindful about how they can access some additional support that isn't necessary. Because if we take it logically that perhaps there could be a further lockdown, that means even a localised lockdown, that means that obviously families and ourselves aren't able to attend face-to-face appointments. So what other methods would we be using to enable there to be a reach into families? And we're consistently doing that at the moment in relation to how we're supporting families that aren't traditionally through a face-to-face contact.
Thanks, and it's interesting, we've just got a comment on the side there about online, because if there are further lockdowns or local, local lockdowns and face-to-face is removed anyway, there's a point here about supporting online learning if there is no digital access. So Peter, are you able to respond in terms of, how students are getting access to digital equipment, if at all, at this point?
It's thanks for the question. I think it's both Trevor and Cleaner. This is a real issue. We know from feedback from schools that there's basically a class divide or a socio-economic divide here. So we know that some young people do not have access to online learning, and we also know that even if there's a device in their house or flat, which house or flat is interesting because that's another digital divide there anyway, but they don't necessarily have access. And I spoke to one secondary head who was really worried because about half of her children weren't logging on and weren't able to log into their learning, and this is one of our large secondary schools. So we received quite a large number of devices from the government, about 900. That sounds a lot, but actually it isn't when you're thinking there are over 50,000 pupils in Enfield schools, and we're very worried about this. But actually the amount of money we would need, and it's not just the money, but it's also the actually accessing the devices. One, it would take a long time. Two, it would be hugely expensive for the local authority. The local authority just cannot afford to provide devices for all the disadvantaged children who need it. So that is quite a difficult one. There's a second question about, and I wish I could answer it. I wish we could provide the online resources. Schools have been providing their own devices and sending them home with young people, but there is a big but here. The devices were for year 10 and year 12, but you've got year 7, 8, 9 and 11, so 10 into 11 now, so quite a difficult one, and this is why we want children in school as much as possible. Second question about bubbles. Bubbles are interesting. The guidance basically says try to follow the bubbles guidance, but if you can't, then you do the best you can. So schools will be approaching this in different ways. Some will have year group bubbles, which in a secondary school could be up to 240 young people. In a special school, it could be that the whole of a setting could be in a bubble. So it's about making the best judgments on a school by school basis. The DFE's guidance is one thing, but the reality is going to be different in each individual school. I think I've answered those questions as best I can.
Thanks, Peter. And there's a comment again from Trevor saying, let's not forget the old-fashioned telephone. It also helps, particularly if we don't have access to digital. So I'm going to move us on to the next question. It says, My job role is a community outreach worker for the primary and secondary school of our chat trust, which I think is community health.
It's Cuckoo Hall.
Cuckoo Hall.
Cuckoo Hall Academies Trust. Yeah.
Okay, thank you. What support can we give our parent carers and children returning back to school after such a long break away? What can we do and offer them?
So obviously Chat is an Academies Trust and they will develop their own ways of dealing with this, but I'm in contact with the Chief Executive of that trust on a regular basis. We are developing, and maybe Emma can talk a little bit about this, a recovery or resilience curriculum for schools. There already has been quite a lot of support through Enfield Thrives Together, which Emma's mentioned, covering a huge range of issues. And you have to remember that children aren't just one thing. They'll have a range of emotional responses. What we found in the summer was children were delighted to be back in school, really delighted to see their friends, felt the new arrangements were pretty strange, but children are adaptable for the most part. But then there are some children who will find it difficult, without a doubt. And then some children will be okay for a couple of weeks, but then it will hit them. So it's about, as most schools will think sensitively about this and try to respond to meet individual needs. But obviously schools will vary. I don't know if Emma, do you want to come in on this about some of the work that's been going on?
Yeah, so I would go right, at the risk of sounding like a broken record, I'd go right back to those 5 principles. So look at your transition plans for September and beyond, and think really strategically about how you are supporting a sense of safety, a sense of calm, a sense of connectedness, a sense of control, and a sense of hope. And I think those are really helpful to ground in all sorts of practical ways. We have a wide range of materials structured under those principles. They're all published on the Enfield Schools Traded Services Hub, but you don't have to trade with Enfield to access them. They're free to access, and I'll share the link. So just as an example, we've produced activity booklets, which are called 50+ activities for primary and 50+ for secondary. And you can go there, you can turn to the sense of safety or the sense of hope and pull out some practical activities which have all been adapted to be kind of COVID safe. The other thing I would think about is, sorry, I was just talking through the 5 principles and then I blanked. Oh, transition. So we know that September is a big time of transition anyway. This is the queen of all transitions. You've got new pupils joining your schools. You've got pupils who are coming back, but they're not coming back to the school they knew, and they're not coming back to their previous classes. So the golden rule with transitions is let people know what to expect. And anything you can do between now and September in terms of getting into your classrooms, into your school, producing videos, putting them on your website, sending personalised books or messages to the pupils who you know will feel most anxious and struggle most with change and transition. Lay the groundwork now. Let parents know what to expect so that they can let their children know what to expect. And if we prepare them well, if we alleviate some of that anxiety, we'll probably save ourselves a lot of that work in September as well.
Thanks, Emma. There's just a question that's come in that's just relevant, saying that will the educational psychologist helpline still be open and available post-September when schools open? And if you can maybe just explain what that parent line is for parents who are listening.
So as part of our COVID response, we took some of our traded service time and we put it into a community pot, and these services are freely available to all. So if you are worried about anything to do with your child, their emotional well-being, their learning, or if you want to think something through for your family, the Educational Psychology Service has offered, and we still are through the holidays, a helpline where you can book a call and just talk things through with an educational psychologist. Whether that will be available in the autumn term is still for decision, but we're hopeful. So the Department for Education has just launched, I think announcing today, grants to support the local authority with the return to education, and we're considering whether we can make the telephone helpline part of that. Somebody's asked about the phone number. At the end of this call, I will distribute the flyer so that it can be made widely available. If in doubt, book a call. We'd love to speak to you.
Thanks, Emma. That's helpful. And it kind of links into the next question, because I'm just going to move this on. And it says, I'm wondering if the panel have any feedback on which methods of support they feel have been most helpful and had the most impact throughout lockdown for children and young people with social and emotional mental health issues. Maybe you stay with you, Emma.
Perhaps more of a strategic answer, but I think from our perspective, it's been Enfield Thrives Together. It's been the way that we've been able to get so many partners together so quickly to coordinate our response and ensure that what we're offering families is complementing rather than kind of overlapping or making things redundant. I hope that effect has been felt on the ground by families, but those are my initial thoughts.
And maybe the Barnet, Enfield, Haringey Mental Health Trust, Clive and Nick, have you got any thoughts or comments and things that you found particularly helpful for young people through lockdown?
So I think, I suppose at a general level, I think just being able to keep our services open and running in a modified form has just been really important for us, actually. So we've, I guess there was some concern early on that some staff may need to be redeployed to kind of other areas in the organisation because of the sort of major incident response and so on. But we've been able to avoid that. We've been able to keep our teams together and our core services together. I think the fact that we've been able to I think sort of quickly provide a flexible offer, really, phone, video, face-to-face still where it's needed has been important, and it's, I think it's enabled us to keep in touch with our young people in a flexible way, and to offer some choice as well around how we keep in touch. I think that's really important. And then to reiterate, I think what Emma said. So I think the kind of partnership and the collaboration at a multi-agency level in the borough has been really important and will continue to be really important as well.
Thanks. And I'm just thinking in response also as a parent, I think being able to communicate effectively with young people and actually listening to them, however you can do that, whether you're able to have a kind of, adult conversation or whether you're having to use pictures or visuals. But I think our children and young people understand so much, they're picking up information all the time. And I think the best things that we can do as parents is actually be able to open up and have honest conversations about what they're worried about, why they're worried, how we might be able to help, and having sources of help and support for parents. So, for example, Emma, the EP helpline has been really, really helpful, I think. And then there's a comment here about additional arrangements for young carers. We've got a question on that later. So can we remind, I'll pick that up about what support we've got for young carers, if you can think about that. I'm going to move on to the next question and then hopefully pick that up. So is there extra money, you've mentioned about the small DFE grant, but is there extra money or resources being invested in the mental health and well-being of children and young people? And if so, what are the priorities? Maybe Cams, while you've got you on camera, if you can comment, and then we can throw it back to education.
Yeah, if I start, because I know Nick probably got quite a bit to say. So I think the first thing is to say that there's been quite a lot of national focus on investment in relation to child and adolescent mental health services. So we know that there's been several papers that have been out over the course of the current government's tenure, including the Green Paper, which obviously led to some of the developments around the mental health support teams in school. But besides that, there's also been an expectation that there needs to be much more stronger collaboration across systems. So when I say systems, I mean in terms of not just borough specific. So looking across the patch. So we sit within North Central London, of which Enfield is part of that system. And there has been some, I won't bore you with the granular details, but there has been some real changes around commissioning in relation to moving away from localised commissioning for health services and moving towards a much more integrated and harmonising of services across the patch. Now, what we might find in Enfield is that we feel that we're a bit of an outlier in terms of equity. Any of the listeners may have colleagues, friends, relatives that live in Camden or Islington, and we know that actually they are slightly more resourced than we are. But part of this new way of working to think about the systems approach is to reflect how do we begin to balance that inequity that exists across the patch. So we've been involved in quite a bit, a piece of work that's ongoing at the moment to look about, actually, if we were wanting to prioritise services, how could we have a standardised baseline of what exists in a neighbouring borough that we don't have in Enfield. So, I mean, I'm sure there's quite a number of examples we could give, but just to say that we are working with our commissions to think about some of those priority areas that we know that we want to support and think about in relation to increasing the offer to children and young people and their families around emotional wellbeing support. And that's an ongoing piece of work that we've been doing prior to COVID. It feels as if it's accelerating post-COVID because there is a lot of expectation now about what we've been able to do that hasn't been the traditional ways of offering support to families. But there definitely is an expectation that we're having to think a bit more about. So Nick talked earlier on about access in terms of the crisis line, the hub, which was more about how we ensure that children that are presenting in A&E departments are being picked up much more quickly and seen by CAMHS practitioners. We're also having to think about what our general waiting time is within the service, how responsive we are to seeing young people across the patch.
Just out of interest, what are the wait times roughly? There was a question.
It varies from which part of the axis you're coming into the service. So if you was a young person that was coming in that had quite that was in an immediate, probably seen within less than 7 days. I'm looking to Nick, it's probably much quicker than 7 days anyway.
So the crisis support would be within a day.
Within a day. Yeah. If it was more of a
general referral,
routine general, there would be a screening. So you'd actually be in contact with somebody within 6 weeks of contact, and then we'd be looking at when the next stage will be for a face-to-face, because there's two contacts that we have around telephone contacts that we also want to make sure that we're implementing within the service. And that's just another example. If you was looked after children's, I think that's less than a week or 2 weeks. For the neurodevelopmental service, again, that's a very short waiting time as well. But what we know is that we have some internal challenges around actually when we're engaging with young people in the service, how responsive can we see them in terms of a specific piece of work? Because there is just as many young people waiting to come into the service as we have in it to then discharge.
Exactly.
So it's a bit rambling there, but
I guess that's the issue about resources and funding, and does the funding resource match up with the need? And I think at the moment the sense is it's playing catch up in terms of resources, that it's not quite meeting the need.
Yeah, and that's the sort of broader piece of work. So this is so it's potential new investments, which is linked to the NHS long-term plan, and that's the work that's happening across Barnet, Enfield, Haringey, Camden, and Islington. And I think one of the key priorities of that is about, so for any future investment that comes in through the NHS long-term plan, that there's in effect a levelling up of service provision across those 5 boroughs,
Okay.
so that the resourcing is kind of proportionate to the population in each of those areas. Yeah.
Not because it's population, but also complexity of need.
Yeah.
I think again, ours will be different to Camden and Islington for sure, even just on the numbers. Okay, I'm going to move us on unless education want to add anything to that. No, there's a not, but I think we all know resources are important, and there's going to be ever increasing need. But this question specific from a parent, and I'm going to merge a couple of questions into one because of timing, but it says here, my child has not been, and they've got in quotation marks, in the system before, but their mental health has suffered terribly during lockdown. As a parent, it's so hard as you don't want a label for your child yet. You want to get them the support they need. Waiting times are a concern. I do consider to be referred for help. Any delay could unpick this. So we've talked about the current waiting times, but also there's another question here. There's a stigma around mental health with children, and how can we all support our young people during this difficult time, as I don't want to say the wrong thing and make them feel worse. So there's something about how do you get help for young people without there being a label or any stigma, and how do we make sure that they're on board and they get to be seen in time. So I'll open that up to Cams and then to maybe to Emma after.
So I guess first of all, I'd say that I think in the borough that there's a range of support options available, of which CAMS is one part, but there are also other services in the borough and school-based support as we've been discussing, really. So I think accessing support could also involve exploring support available through school. That we've also recently in Enfield that we've launched. There's an online platform called Couth, which offers online support for 11 to 18-year-olds. So there are kind of range of options there. I think also I would say that I think kind of good practice, and I think our perspective across children and young people's services is one where I think we focus on understanding the needs of the child or young person and family, and that's what comes first. That it's not it's not a diagnosis-led approach. It's about understanding needs and reaching a sort of shared understanding of needs together. Was part of the question about waiting times.
Yeah, I think we've kind of covered that. It sounded like in crisis it's within a day or 7 days, but actually it can be 6 weeks to get a normal referral and a point of contact. I think the other thing was about stigma, and have these conversations around mental health and it not be a label that they feel worse about.
Yeah, so I think stigma is something that young people that we work with raise a lot with us, and they and so, for example, in our participation group, they frequently talk about they'd like to have more open and prominent conversations about mental health, say, for example, in a school setting, for example, in their communities. I guess so stigma is a concern. I think it's really important that we talk about mental health and that we promote a broader conversation about mental health. I suppose the issue about the kind of the worry about saying the wrong thing, I suppose I feel it's always better to try and have the conversation about feelings and about emotional well-being rather than not at all, and that it's better to have that conversation, imperfectly sometimes as well, rather than to be constrained by kind of feeling that we must get it absolutely right all of the time as well. I think in many ways, I think a lot of it it's partly about what you say, but I think a big part of it is about how you say it, so I think talking to children from a perspective of curiosity, interest, listening is really important, and kind of connecting back to those kind of core principles that Emma talked about, I think is really important.
Yeah.
Checking things out, going at your child's pace, not necessarily rushing to find solutions, which often as parents we feel we want to sort of come up with a solution, but I think listening and kind of going at your child's pace is important as well. And I think there are I think it's important to create a space for children to talk, but not necessarily forcing it. And I think also recognizing the sort of strengths that your young person, that your child has, and offering a sense of hope as well is really important. I guess the other thing is there are lots of resources out there as well that we can, I'm sure that we can sort of add kind of links to those maybe and circulate outside of this conversation. So really good resources through that have been developed locally through the local authority. The Anna Freud Centre has very good information on its website for young people and for parents. They've done some linking with BBC Bite-Sized to produce some really good resources as well.
So that would be great, actually, because we've already got some on the chat. We've got some links to resources, but anything else that you can share would be really useful. And Emma, I was just can you just come in with a 1 second nugget or a 1 minute nugget, just to any points for parents from your perspective?
I would say that increasingly there's a widespread agreement that mental health is everyone's business, and schools are on board with this. The education system is needs-led, not diagnosis-led. So I'm sorry things are so difficult, please do speak to your child's school. And I really agree with Nick that probably I know it's so difficult when you worry about saying the wrong thing, but probably here the wrong thing to say is nothing. And anything you do say will be better than saying nothing.
And I think Nick's point and your point in the principles is about that curiosity and exploring. So there's no judgment and there's no right or wrong. It's just about how are you feeling, what's happening, and I think it's just about opening up and talking, however that might happen. So parents know their children best. It might not be an inquisition and an interview, but you might do it while they're playing or while you're cooking or any time when it's informal and you're just having an informal conversation. Try and help them to kind of open up and talk. And to say we'll add some more links to these resources. So I'm going to move us on. Thank you, Emma. But can I keep you still on, and then we go back to Cam's just while you're on? We've got another question here. It says, it might be a Cam's one. I'm seeing signs of anxiety about germs and cleanliness in my child. The constant wash your hands messages have been deeply absorbed, and now there is a real fear of coronavirus and getting ill. What can I do, or what could you suggest?
We are in this extraordinary situation where what until a few months ago would have been health anxiety, would have been a recognised condition, is now a response that we've been trying to instill in our children. We want our children to be afraid of catching coronavirus, and for some of our children we've done a really thorough job. So I'll hand over to Nick because I know he can talk about the principles around kind of how we might address some of those worries about health. But I would say as well, I guess our lives have shrunk, and when we have an anxiety like that, our lives become very, very narrow. So to hark back to that idea of we want to address this problem, but we also want to think about how we give our young person connectedness and a sense of control and a sense of hope, and kind of encouraging them gently to choose that bigger life, even as they battle with those worries. But I'll pass to Nick because I'm sure he's got some helpful thoughts.
Thanks, Emma. I agree absolutely. So I guess in some ways, for many of us, I think that issue of sort of heightened anxiety around kind of infection and germs has become much more the norm, really. That we are all sort of more conscious of our behaviour around kind of hand hygiene and social distancing and so on. And I think, I think it's really important that sort of being able to recognise that anxiety in your child, and I suppose similarly to some of the things we discussed in the previous question. So to be able to sort of, I guess, to sensitively and with curiosity, kind of explore and understand some of your child's worries, that's I think that in itself plays a really important part, and can, I think, in itself lead to some sort of soothing and calming of that anxiety as well. I think another side to it is about I suppose helping children to develop in a way a more kind of balanced view of the danger and the risks is kind of one of the challenges that we face. That it's very difficult in this situation where we're all being told that there's this kind of unseen kind of threat around that we've got to be alert and vigilant to. But I think there's something important about trying to put that in perspective, which also kind of helps bring a bit more of a sense of kind of control and hope as well. And so that might include things like, I guess, paying attention maybe to some sources of information around COVID. So thinking about, some of the resources around, or kind of age-appropriate information. So, for example, thinking of like younger children and sort of, I guess, following news and information about COVID, things like news rounds and so on, and things like that. So I guess I think being aware of the kind of sources of information, kind of sources of news and information and so on, that's kind of appropriate to your child's age and so on, and having conversations about that. And I think, kind of modelling, I guess, a sort of proportionate kind of response to kind of to hygiene and hand washing and so on, and to the risks. And very much, I agree, as Emma said, about kind of the importance of kind of keeping involved in broader, positive, affirming activities as well is really important. And again, kind of referring back to some of these, I guess, resources and sources of support through the Anna Freud Centre, through Young Minds, and so on. I think there are many really good, kind of reliable resources there around, kind of aimed at supporting, helping parents support their children's anxiety during.
Nick, sorry, I'm interrupting, but so we've talked about the resources, but I guess what I'm hearing from yourself and Emma is acknowledge the fact that there are anxieties, but actually it's understandable because we are asking people to, whether it's wash their hands or be worried about COVID. But equally, we just got on the chat line there, again, linked to the resources there for people that might need it. And we will print it out in our Q&A when we publish. But also it's about balance. So it's about ensuring that, yes, we have to wash our hands, but if you do, then that's fine. It's looking at risk, and actually coronavirus cases compared to what they were in lockdown are much lower. So it's about putting things in perspective, but also you mentioned about hope. So actually trying to make sure that, there's positives to going out, to enjoying yourself, to being healthy, and the things that might help motivate. So there's a question here, which is a tough one. And I'm going to move this on just because of time. It says, my child used to like going out to play in the park and loved going to school to see her friends. Now she's happy to stay at home, but now doesn't want to go back to school and is not interested in going out to play. What can I do? I guess I'm going to ask that to Nick, and then otherwise to Emma. But
so I think similarly, I think partly it's about I think exploring and trying to support a child around their, what may be sort of possible fears about going out and returning to school and so on. And I think, I guess, as we've said before about, trying to have that conversation and to listen and to understand those fears. I guess, I suppose one of the things we've found sort of really important with the children and young people that we've been working with throughout lockdown is about, I guess, trying to find ways to gradually, I think, both to sort of keep some structure, but also to kind of keep kind of linked in to kind of broader activities. I think a bit like Emma mentioned earlier about kind of broadening one's world a bit, and I suppose I think it's partly about finding ways of gradually maybe just testing the water and extending activities or contact with friends as well. And I guess also, that I think just as children and families have faced big changes going into lockdown, they're facing big changes coming out of lockdown as well. And I suppose, and I think as far as possible, it's important to try and involve your child in planning for some of those changes by kind of having an open conversation with them about it. That might help give a little bit more certainty or a sense of control about what's on the horizon. That might include things like talking about ways that they may be able to start having a bit more direct contact with friends and family.
So maybe kind of a more gradual,
whilst keeping the same.
Yes. So what you're saying is a more graduated approach. So where they are, but actually adding and developing aspects of their life that they can be involved in, but how they can control it. So it might not be that you're going off to the park tomorrow, but it might be even talking about going back to the park, or who might they enjoy seeing with their friends, or which friends might they want to see first in the park. And I guess trying to find what motivates them. And yes, okay. So I think what we're saying is resources, curiosity, ask, listen, and maybe, we've used the phrase social stories before. So maybe pictures, visuals, activities that are going to happen in terms of going back to school. I know some schools have got videos posted of their school and lessons and what things are going to be like. So again, maybe parents contact schools to find out what resources there are in terms that might help their child go back to school that already exists, because that would be helpful. And I think maybe schools are not always able to tell every parent. So if you're worried, go to the school and ask them directly yourself, I think. I'm just going to ask a last couple of questions. I'm just conscious of our time, and then we'll have to round up. There are a couple of questions about, we will have the Q&A published once it's authorised with all the links on, and we will have the recording, but it has to be authorised, so it will be a couple of weeks, but you will get this information. I think the Q&A and the links will get out quickly onto our website because of the timing. So there's one question here that I wanted to ask. It says here, my son has noticed that his friend has become withdrawn and disinterested in the online games they used to do together. I do not know the child's parents very well and I feel that I should say something. Is it best to get my son to ask him how he's feeling? And whether that's Emma or Nick or whoever wants to take that.
I think that that thread of curiosity that's been running all the way through still stands. So just off the top of my head, I'm wondering whether this child has finally hit saturation with online gaming, which we didn't know was possible before the pandemic. So perhaps this is a young person who's engaging more with the outside world as lockdown is easing. So it's definitely something worth wondering about, but I would be wondering rather than assuming that something's terribly wrong, perhaps. Do we want the questioner's son to ask his friend how he is? Absolutely. We want to create a culture amongst our young people where they ask each other how they are and they genuinely listen to the answer rather than feeling pressurized to say, yep, fine, all fine. But at the same time, I suppose, as the parent, you want your child not to feel overly responsible for the mental health and well-being of their friend. So yes, I would encourage your son to ask his friend how he's doing, and I would let him know that you're there to support him if he does feel worried about his friend for any reasons. And there's a whole kind of range of services and resources behind him and behind his friend if his friend needs extra help with anything. Did you want to add anything, Nick?
No, absolutely, I agree with that, absolutely. And I guess I suppose just the only other thing is, if there is, I suppose if there's a trusted adult that you may be able to speak to, or your son may be able to speak to as well, you know, I think that's another option as well, because I think, yeah, absolutely, I agree. We want to help young people have those conversations and be good, supportive friends and so on. But at the same time, we wouldn't want them to feel that they're kind of carrying kind of all the responsibility for helping people as well. And so, you know, I guess frequently I've worked with young people where, you know, say a friend in school has maybe spoken on their behalf to a member of the pastoral team, and that's really helped that young person access support. So so I think also kind of communicating, if possible, with a trusted adult is really helpful too.
Okay, thank you, Nick. I'm conscious of our time. I just would like to wrap up. So I think what I've been hearing is that there is support, there are resources. We've got some of those already on the chat, but we will publish them on our website, make sure they're accessible. We should be talking about this openly. We should be asking questions and asking our young people what they're thinking, how they're feeling, but in a curious way, not in a demanding way or a judgmental way. And we need to be listening to those answers. There are access to services via the school. So I think for most parents, if you're concerned about anything, do contact your school or college. They do have resources. They will be able to communicate in terms of what September will look like if you don't know. And it sounds like preparing and planning our young people for that return is really important. So talk about it now, what's going to happen, how it might happen. And say, if you're not sure, speak to the school. If you're worried about your child being anxious and returning to school, again, let the school know. I think if you're not in a school setting or a college setting and you don't want to, and you're homeschooling, or it might be the child is absolutely refusing to go to school, still let that school or college know. But it sounds like maybe you could go to your GP and talk to your GP, again, online or via the phone. I know many are not doing face-to-face. And it sounds like schools are being supported by the local authority to support our young people's mental health, particularly in the return. But I guess there's going to be lots of work to do. So I think, is that a fair summary? Is there any last points to add? Otherwise, what I'm going to do is I will close this. If you can, everyone that's listening, if you can make sure that you do the evaluation, because we'd like to get feedback in terms of this call and how you felt it went. We hope you found lots of useful information. And thank you to our presenters. It's been really useful and insightful. And again, just opening up and having this conversation about our young people and their mental health is really important. And we do have our next online session on the 16th and the 29th of September with Age UK. So if anybody's interested, do log on to our website to find out further details. So thank you, everyone. Thank you for listening. And without further ado, I will stop recording and end the call. Take care, everyone. Good mental health and good luck for all of our returns to school and college.
Yeah. Take care.
Absolutely.
Bye.
Bye.